I can tell those emergency vets are getting fired up by this,
Right.
this virology talk. They're going to sign up to a PhD any minute.
Hi, I'm Hubert.
This is Gerardo.
Hi, I'm Dave Collins. I'm a small animal medicine specialist who works in the north of Sydney.
And you are listening to the Vet Bob Clinical Podcast.
Welcome back to more feline infectious peritonitis. In part 2 of our FIP series, Dr. Sally Coggins, feline vet and FIP researcher, tells us about other potentially successful treatments like mefloquine if you are unable to use Remdesivir. In other words, if you are not in Australia or the UK where you can get it legally compounded by BOVA. We also cover off on side effects of Remdesivir as well as the practicalities of the treatment period, like how to help clients with those painful injections. Then, before we wrap up what's new in the treatment of FIP, once you get to the end of the episode, keep listening for a 10-minute discussion I had with Ali, who is a subscriber and a vet nurse from the UK who had treated her own cat with GS. I wanted to get an insight on the treatment from an owner's perspective, and I think it adds something valuable to this episode for when we have to talk to our clients through this whole entire process. Just listening to a talk about the anxiety she, as an experienced vet nurse, experienced around injection time is a real eye-opener to me, and I think well worth your time. Joining us as co-host is Dr. Dave Collins, medicine specialist and organizer of spectacular snow-based vet conferences with Vets on Tour. Go check it out at vetsontour.com.au. And remember to go to vvn.supercast.com for a free 2-week trial of our Smallies Medicine Emergency and Critical Care and Surgery podcasts. We know how hard it is to commit the time to sit down for ongoing CPD, and we know how quickly you start feeling that you're falling behind on current treatments, or start feeling rusty about all the stuff you learned back at university, which is why we think you will love these. 3 episodes a week that will take you from, I don't know, to being a total boss, all in the space of your drive to work. Once you join up, you'll be able to listen to all of our podcasts on exactly the same place that you normally listen to podcasts, including the Apple Podcast Player or Spotify. And we will send you some beautifully made show notes with all of the good bits so you can refer back to it later, because we know that you're going to forget. All right, Sally, Dave, Ali, and FIP.
I'm just going to ask you about mefloquine versus hydroxychloroquine, which a certain guy was promoting a bit. Can you give us some insight there?
I know. I was in the process of submitting my research application when Trump started banging on about hydroxychloroquine. I'm like, mate, you're undermining my PhD. Mefloquine for cats, I can definitely comment on. You know, we did a lot of the groundwork. The wonderful PhD people before me have done the pharmacokinetics in cats on mefloquine, have shown in vitro that it inhibits coronavirus, that cats' livers metabolize it well, and that it's well tolerated in healthy cats. And we have at least one success story with mefloquine. It was a vet-owned cat who was definitively diagnosed with dry FIP and went on to mefloquine with interferon and is more than 2 years down the road in remission. And for the mefloquine trial, we do have 2 treatment groups. So there's straight mefloquine or there's mefloquine plus interferon, so the Verbogen feline omega interferon.
So there's still a role for interferons in managing this disease?
Yeah, I guess when we break down FIP and treatment of a disease like FIP, I think it's still important to go back to basic principles. Like, we've got a viral disease, we've got a cat that's mounting an inappropriate immune response, and we've got, you know, an immune-mediated sort of cascade happening after that. So historically, we've lent on immunosuppressive drugs to try and quash that immune response, or we've lent on the immunomodulatory drugs like interferons, and they haven't been enough on their own. But I think if we have antivirals plus something to boost the immune response, plus maybe something to dampen down the immune-mediated sort of consequences, then we're probably going to end up with more effective treatment. But what's blowing that concept out of the water is the fact that Remdesivir seems to be working very well as a sole therapy. So we might not need to add those other bits in, but I think mefloquine is not going to be, my hypothesis is that mefloquine is not going to be as effective as Remdesivir, so it will probably do better with a bit of help from something else, basically. But I think the big thing about mefloquine is it's a generic drug that's been around for ages. It's cheap. Like, you buy a box of it and that's going to last you well past the 12 weeks of treatment for this cat, and you only have to give it twice a week and it's oral, as opposed to Remdesivir that's very expensive still, unfortunately. It's going to be cost that is the reason why cats don't get treated, which is why I'm still very keen to explore the possibility of mefloquine as an alternative antiviral. And even if it's not as good, if it improves quality of life for a period of time or puts some of these cats into remission, it's better than nothing. And I think, again, our hypothesis is that it's probably going to be more effective with early stage dry form FIP. And we've got studies to suggest there's quite good concentration in CNS. So whether it has maybe more application towards your ophthalmic and neuro FIPs, because it crosses the blood-brain barrier a bit better. We know of cats in the field that have been on Remdesivir, gone up to 10 mg per kg, gone up to 15 mg per kg, and then we've added in mefloquine. So we can use the two drugs together potentially as well. And that's where I just need to keep doing PhDs until
you're old and grey.
I mean, my overriding thing is these are client-owned cats. They're voluntarily enrolled in this, and I never want to be preventing them from getting the best chance at treatment and a cure with this disease. So if that means we've exhausted Remdesivir to the extent where we don't want to go higher or they can't afford to go higher, then yeah, we're probably going to suggest that they add in mefloquine. Whether they can stay in the trial or I just track them retrospectively moving forward is probably the way it's going to have to go. But I think for vets on the ground that don't have cats in a clinical trial, if they're not responding to that 10, 15 mg per kg, or if the client can afford 10 but you're not happy it's going into remission, I'd definitely be adding mefloquine on board. And so the dose rate for mefloquine, you're wanting 10 to 12 mg per kg per ROS twice weekly, but I know Richard Malik is suggesting 3 times a week, and that seems to be being tolerated as well. The biggest thing with mefloquine is it definitely can upset their tummy if they take it on an empty stomach. So you just want to make sure if they're on mefloquine that they're getting food with it. In terms of the mechanism of action, like the nucleoside analogues really are targeting viral replication, whereas mefloquine, we don't 100% know, but the suspected mechanism of action is that it's actually preventing viral endocytosis into the cells. So if you've got an antiviral that's inhibiting replication and then you've got something else that's stopping the virus getting into the cell in the first place before it can even start replicating, it suggests to me that those things would be synergistic. So yeah, I think when we're faced with a refractory patient, we are going to have to reach for other things, but touch wood, I haven't had one yet.
I wonder if you could reduce the dose that you need for Remdesivir by using as a cost-saving device.
I guess the thing that I definitely say is do not go below 6 mg per kg to try and make Remdesivir last longer. I've seen plenty of emails coming through from vets out in the field that were like, the cat was doing well initially, but owner started to run out of money. So we reduced it down to sort of 4 mg per kg or 3 mg per kg to make it last the 12 weeks or try and stretch it out for longer. I think that's more likely to promote more resistance. It's a bit like going, well, they can't afford the full dose of Clavulox, so we're going to half dose them. I think you're better to go hard for as long as they can afford it, and then probably start them on mefloquine at the same time if they can't afford a full 12-week protocol. But yeah, definitely don't underdose and be really vigilant for weight creep, because a lot of these are kittens that are growing and this is a 3-month period. So if they're doing well, they're going to be putting on weight. Like we've got 2 Maine Coons in this trial and they're definitely putting on weight as we go. Although it may be cost prohibitive to monitor them as closely as we are, we're doing bloods every 1 to 2 weeks, depending on what point of the trial they're in. I think even if you're not doing bloods, I'd do bloods every month generally if I was going to be monitoring them, but I think doing weight checks in kittens at least fortnightly is important just to be adjusting doses. And the other thing that I'd say to dosing, which again, I'll need to create quite a discussion piece in my thesis, I would say, but with the wet cats, we're dosing them on their body weight, including fluid. Don't try and estimate lean weight. We're starting with the cat in front of us, including its fluid. Okay. And we're keeping that dose stable so a lot of these cats will drop weight in that 1 to 1 to 3 weeks when the effusion resolves, keep them at the same dose that they started on. So if their weight drops, keep them at the same dose that you had them on as a 6 mg per kg or whatever the maintenance dose was before the effusion resolved. But as they're starting to put on healthy weight, you definitely want to keep increasing it incrementally, because we've seen cats in the field who have come out of remission, but when you go back and realize what dose they're on, the cat had put on 400 grams in that time period. So they'd dropped below that sort of 5 to 6 mg per kg and had come out of remission.
Okay.
I'm trying to figure out what the least effective dose is, because it's such an expensive drug. Like, the less we need to use, the better. And if we can figure out, okay, these are 100% or are most likely the best indicators that these cats are in remission, do all of them need 12 weeks of treatment? Probably not. Like, I reckon there are some of these cats that you'll get away with treating for 8 weeks. But at the moment, the preference is 12 weeks so that we can get some data behind it.
When you're running those monthly bloods, or at least monthly bloods, what are you checking for? Obviously, you want to look for globulins. What else? So
I think biochem hematology is the main thing that I'd be doing. If, again, I'm cat vet Sally, not researcher Sally. Really, it's sort of seeing what our blood ratios are doing. Bilirubin's a big one too. Usually that you want that to be coming down in the first sort of month or two of treatment. And then a lot of these guys have anemias, which do take a bit longer to resolve. And that was sort of the same finding with Peterson's paper with the GS441524. Anemia was probably the last thing to resolve, like out more to that 8 to 12 week phase that they're going to see resolution of that. For us, we want their lymphocytes to be coming back up to normal too. A lot of them will be persistently lymphopenic from diagnosis. And again, that seems to be one of the later things to correct. So yeah, it's really sort of white cell, red cell, and particularly the proteins, what they're doing. Most of the other stuff has resolved. But as I said, those ALTs, we haven't used a persistent ALT as a reason to extend treatment at this stage. I'm still, like, those cats are 2 weeks off drugs, so I might live to regret that and restart them. But at this stage, everything else suggested those cats were in remission.
Have you got any comment about monitoring enlarged lymph nodes? Because if you've got measurements on ultrasound and...
Yeah, unfortunately, again, because I want these cats to be able to stay with their clinicians. When we've got them in the clinic, we've got a better chance of, like at the uni clinic, a better chance of getting some imaging on them. And if I get my hands on a cat at Gordon and it has big lymph nodes, I'll definitely be ultrasounding them sequentially. So I think if you've got the capacity, that's a great tool. And yes, I would be saying for a dry FIP, if it presented with big mesenteric nodes, you'd probably want them to be normal before you discontinue the drug.
Now, the injections, buprenorphine, gabapentin, I don't know if there's a role for mefloquine or something like that.
Yeah, a couple of the cats are on gabapentin. They're needing like 50 mg of gabapentin to allow the injections, which the owners still feel that it's, the cats aren't too traumatized. Like, they don't like injection time, but the rest of the time they're cruising around, they're happy cats. I'm definitely aware of there being, cases in the field where owners just can't continue with injections because they're getting bitten by the cat. And, the cat, it's always the Bengals and other sort of, because it's always the purebreds that are getting
They're pretty feral anyway.
Exactly. I don't like vaccinating those guys some of the time. But yeah, I think it's the biggest hurdle that we've got, a second to cost. So in terms of how well these cats are tolerating it, from physiologic perspective, they're tolerating it great. But from a behavioral side of things, it certainly doesn't seem to sting every cat. Like, the majority of cats on the trial, owners are feeling that maybe every now and then they flinch when they get the injection, but it's not like a daily sort of trauma. But I think, I feel there's a bit of variation with Serenia, as well, whether you've refrigerated it or not. Some cats seem to fly off the needle with it. Others don't even bat an eyelid. And I think it's probably going to be similar with this. I think it is definitely worth exploring the behavioral side of things and investing in that sooner rather than later, like establishing positive injection routines and reward components and distraction, and making sure owners are feeling confident with technique, because I think a lot of the time it's the cat's reading, the owner's hesitance, and the owners are getting stressed about giving something that might make the cat scream. That's ramping up stress levels in general in the household. So I think it's really important to be supporting owners through that. And there are some cats that I'm aware of that are just coming in for a daily injection with a nurse, or having, if we are allowed in COVID times, having nurses do house calls and things as well. There have been the occasional cat, at least one I know of, that just wouldn't tolerate subcutaneous injections. So there were, IV catheter replacements every 3 to 5 days and continuing IV administration. But where I think this is all about to change again is that I'm very confident that we're eventually going to have an oral formulation of the GS 441524 that is going to be legal. We know there's been products over in the States and things that have come on and off the market that, again, owners have been getting into the country through social media sort of networks and those sorts of Facebook groups. But I think definitely trying to explore an oral version of this is going to be a bit of a game changer for those cats that you can't get injections into.
Because every cat loves oral medication.
Exactly. It's about having options. My cats, I would prefer to inject them hands down than tablet them. But even to be able to start with one and switch to the other, I think anything that gives us some, options is always a good thing. So I would be very surprised if we didn't start to see some kind of an oral option come onto come into our availability in the next sort of 6 months or so, just because of how much growth there is in antivirals in the world at the moment.
So would that be Australia only, if you say we, Australia or globally?
Yeah, I guess Australia is what I'm talking to in terms of our ability. Really it's, BOVA sort of really pushing forward with the compounding side of things and doing some amazing work at trying to get access to these compounds through compounding methods. I know they've just successfully also launched Remdesivir compounded in the UK, which is wonderful. So UK vets can now access Remdesivir the same way we can. And so, it'll likely come through them if there's an oral formulation. I know they're trying to formulate that, and I suspect they'll be successful with it. And hopefully that gives us an oral option, which, again, I'm going to be putting in an additional ethics application to try and trial.
Now, I'm super curious about how all of that works. So the actual molecule of Remdesivir, a compounding pharmacist like BOVA, they'd get that from another. They're not making the molecule.
No, they're manufacturing.
They're actually manufacturing.
Yeah.
Oh, wow.
Yeah. So, and that's why these are really complex drugs, and I'm not going to pretend to understand the complete details of these things, but it's a really complex manufacturing process, and there's several phases of development with these drugs. So from woe to go, I think it takes at least weeks to actually create this drug. So they're hard drugs to manufacture. So I think there's plenty of hurdles that compounding pharmacies are having to overcome to try and give us this option.
Well, how is it not legal in the other countries? Do you understand that?
Yeah, I'm not familiar with how other countries see compounded drugs in terms of whether they're classed as veterinary chemicals or not, because that's the defining thing for us, is that it's not classed as a veterinary chemical, so it doesn't need to be registered with the APVMA, which puts the responsibility back on us as vets to go, well, do we trust the manufacturer? Are we confident that why we're dispensing this is valid?
Remdesivir, does it have any side effects apart from just kicking ass and killing coronavirus?
Yeah, so aside from the injection site reactions, we're not finding too much. We're seeing, and I'm not going to pretend I can explain this in a scientific way yet, but I'm definitely observing quite a few of these cats are having persistent ALT elevations, but a lot of them had liver enzyme elevations prior to commencing the drug. So I'm not convinced it's definitely a drug reaction. But when we look at what Remdesivir might do from an adverse effect in other species, it's certainly, got the potential to put things into renal failure and liver failure and have anaphylactic reactions, when you look at rodent and monkey and human trials. So again, I think that's where it's really important that we try and do the due diligence with this drug. And although it seems to be curing cats right now, if it starts killing the occasional one or two, we probably want to be prepared for that and make sure owners are prepared for that as well. But so far, really it's just the injection site reactions and sometimes actual skin reactions, like getting some crusting around the injection site, that seems to be the main issue. The one other thing I'll say, and I haven't come across this in any of the cats in the trial, but when we were talking to clinicians that were already using Remdesivir while we were developing the clinical trial, we know of at least 2 cats that developed pleural effusions in the first 48 hours of starting Remdesivir, and these were cats that didn't have effusive disease with their FIP to begin with, and they were on, bugger all IV fluids, like 0.5 ml per hour kind of thing, like not even maintenance level fluid. So it's very unlikely it was fluid overload. They weren't, presenting with any other cardiac kind of symptoms. I can't explain that, but I guess it got our attention, and we've generally been saying you want to have pretty close eyes on these cats for the first couple of days that they start the drug, which is where we're recommending hospitalisation and that intravenous protocol. But there are plenty of vets in the field now that will just start the higher doses of subcut injection and manage them as outpatients from the start. So they have the 10 mg per kg subcut, but you send them home and maybe get them back every couple of days to make sure they're doing okay. And with that sort of use of the drug, I'd definitely be teaching owners how to do resting respiratory rates so that they can at least track for any signs of tachypnea or anything developing at home and know to represent if that's the case.
The last kitten I treated was a dry cat that sort of rumbled on for a couple of weeks with fevers and whatnot. Massive mesenteric nodes, and I just sampled them and got the diagnosis. And then it came, while we were stuffing around, it came crashing into the clinic with a pleural effusion. Before treatment, I might add, but the fluid wasn't high protein at all, but it had massive mediastinal nodes, and I think it was an obstructive effusion.
That's entirely plausible. I do think these effusions can happen pretty acutely when they've been smouldering on for a while. So it wouldn't surprise me if it does turn out that was just sort of coincidence and it was more the disease itself that these cats were going to get the effusions anyway. But it's just something that's on the radar, given that it seemed to happen more than once in the first handful of cats that were being treated with it.
Okay.
I just want to touch on the injection site reactions. First of all, how common is it? And then B, if it happens or when it happens, what do you suggest to owners? Just push on through it, just deal with it? Or is there anything you can do to
I guess rotating sites a little bit. I guess with any kind of injection site reaction, cats generally do come with reasonable handfuls around the scruff area, so just alternating sides that you're injecting in and rotating sites. None of them that I'm aware of have really needed that much treatment. Like, it's a bit of focal alopecia and some crusting, but it's not been even as severe as, sometimes you'll get top spot reactions to flea products and stuff. My understanding is that the cats that have had those reactions, it's not been particularly pronounced. I think in terms of how common it is, I know definitely 3 out of the 12 have had it at some point, but it's not like it seems to be reported on one fortnight and then it's resolved by 2 weeks later. And so I don't know that it's necessarily an ongoing thing either. But again, it's early days in terms of the hard data I've got around that. So get me back on in 6 months and I'll let you know.
Okay, so not a huge issue. Certainly not a game changer. It's not going to stop you from treating them.
And again, like I think when you put it in context, I mean, the alternative is death. So,
100%.
So Dave touched on it before when he talked about adjuncts and things to help with making injections better with gabapentin, buprenorphine, mefloquine. Do you find that those things are useful? Or
I think definitely gabapentin and buprenorphine have a place, and a couple of cats are definitely receiving gabapentin to allow that. Mefloquine, it's not going to hurt. It is so definitely give it a crack. I think the bit that's stinging is the fluid under the skin rather than the needle going through the skin. So I think it's probably got limited benefit, but I guess anything that reduces any sensation on that area is potentially worth trialing. But yeah, I think generally with stinging things for me and cats, it comes down to distraction techniques a lot of the time. It's, one person flicking in the cat's face, distracting it, or shaking food in front of it. And I will often be massaging the scruff at one end when I'm injecting in the other, just to sort of try and, I guess, reduce awareness to that particular point.
What about other adjuncts? Do you guys, is it just Remdesivir and then that's it? Or what other meds do you?
Yeah, was there some talk of initial steroids, for example?
I'm sort of suggesting if they're on steroids when they come into the trial that they're tapered off in that first week or two, depending on how long they've been on it. We're not having to reach for them. I'm certainly saying it's open slather in terms of supportive meds like meropenem, appetite stimulants and things. But I guess I'm not advocating that they should go on to steroids, mainly because they all seem to be responding without the need to add those in. And my preference is to figure out how good this drug is without other things complicating the picture. But if I'm, the cat vet out in the field, not the researcher, and I've got a cat that's been on Remdesivir and I don't think it's responding as well and I know this is FIP, then yeah, I probably am going to start to throw other things at it.
I can tell those emergency vets are getting fired up by this virology talk. They're going to sign up to a PhD any minute.
I'm actually just blown away by the level of, like, I don't know, knowledge and tech and background knowledge and stuff. I'm like, I feel like a dumbass. Let me just put a tube down a GDV's stomach.
And how can I cut it open?
How can I cut it open?
No, when I asked about other drugs, I was mainly trying to ascertain whether the GS and especially the black market stuff, whether there are issues with it, where there are people having problems with it.
I don't have too much knowledge about the GS. It's still floating around, and again, the clinic that were like feeling that maybe GS was a bit more effective, I think they were being guided mainly by the owners who transitioned midway through. So these were cats that had started on GS 441524 and then Remdesivir came on the market legally. So they're like, cool, let's switch to Remdesivir. And then they felt like it wasn't working as well. So they went back to the black market stuff. So it's still floating around, but my feeling is Remdesivir is probably as effective. It may just need a slightly higher dose rate. And I think both are expensive.
Okay. Yeah, because I suppose what I'm getting at is you're gonna have clients say, I can get it cheaper on the internet.
Look, it could be the case. And I guess, if I was trying to manufacture it in China, I would be starting to undercut whoever was providing it. We may hit that barrier. I think, really for me, that's going to come down to, well, I trust BOVA, are a reputable pharmaceutical compounding company that have a very high level of internal controls and compound to a very high standard. So I'm going to trust that over something that rocks up in a makeup box from the internet.
Yeah.
Are you enrolling? Can we put details in the show notes? Or
yeah, I think definitely put details, because I'm super happy to chat to any vets that just want to, I feel a bit more comfortable about starting Remdesivir for the first time. I'm very happy to, I try and reply to emails as quickly as I can. There's quite a few of them now because the Facebook groups have got my email address too. But definitely, so my university email, so it's just sally.coggins@sydney.edu.au. You're welcome to hit me up by email. And yeah, I'm happy to have a chat over the phone or over email communications with you guys. Richard Malik, as always, is an amazing person to chat to about curly cases as well. But I am definitely recruiting, and what I would say to vets is talk to me before you give the first dose of the drug. There are definitely a few times where we've been suspicious enough that we've enrolled these cats as if we've confirmed the diagnosis, because we need to start them on treatment. The owners want to start them on treatment. The drug's arriving tomorrow. I'm not going to make this cat wait 5 to 7 days because it's in Perth and we've got to ship the fluid across to Sydney and then do the test. So I don't want to delay treatment. And in those instances, we can generally try and figure out a way to recruit and then unenroll them if we can't confirm the diagnosis. But, they can continue on treatment with their vet, and I'm very happy to still help their vets out in terms of directing advice on how they proceed.
Cool.
But yes, talk to me before you give the drug, otherwise I can't enroll them.
Are we missing out on anything, Sally, or are we done?
I think just, again, highlighting that mefloquine is something that's worth considering. Cost, as I said, is probably going to be the biggest barrier we hit with these nucleoside analogues, regardless of what form we end up being able to get them in. And I really want mefloquine cats. So if you've got owners that can't afford Remdesivir, that may not even be able to afford the confirmatory test, but are looking really suspicious of FIP, then talk to me, because we automatically run the IFA and the PCR at day 0 of that treatment. So again, if they're really suspicious, we can enroll them, run the test. If we can't confirm the diagnosis, then again, they're welcome to continue on the mefloquine, and they've got the protocol there. But I really want mefloquine cats because I've got ethics for 30 of them and I've only recruited 2 so far.
Okay, great stuff. Before we listen to Ali, just a few more details about what's happening with drug availability. I've done a bit more digging and I can confirm that the oral version of GS442524 is a definite go-ahead and should be available here in Australia pretty much by the time this episode launches. And just for a timestamp, we are near the end of September 2021. And not too much later in the UK, where the approval processes are a bit more stringent. The oral version has to be GS and not Remdesivir, because Remdesivir does not get converted to the active GS molecule when taken orally. Price-wise, while it still won't be a cheap drug, it does seem that it will be a bit cheaper than the injectable Remdesivir. So, when you diagnose your new FIP, give the guys at BOVA a call and check out what is available. Okay, over to Ellie and Mabel. What's your cat's name?
Mabel.
Mabel.
She's here.
Yeah. Oh, she looks like a healthy cat. How old is she?
12.
She's 12. Did she get the dry form?
And she was wet. She had a massive belly.
Can I say you're a vet nurse?
Yeah, I don't see why not.
Because I want that perspective coming from a vet nurse who's used to treating animals and handling animals and just get an idea of how hard is it as an owner to do it.
I think that the new owners cope better than I did, to be honest. So people that are, they've got a cat and they get told they need to do these injections and they've never done injections before. Yeah. And they just pick it up so quickly because it's got to be done because they're saving their cat's life.
And do you get an idea from the chat rooms and that, how common is it? How many people are using it? I don't know, you can't give me a number, but is it everywhere? Is it a common thing?
So in the UK, we probably get a couple of new cases a day joining and starting treatment.
Wow. And tell me, so on the chats, is it as positive, the outcomes, as the initial report suggested? Like, do you have a lot of people who don't have success, or are they mostly happy stories?
Most of the ones that start early go through treatment, and from what I've seen from being on there for a few months, most of them go on and do well. The ones that we lose, I think, are the ones where the cats are really, really too poorly to start treatment. Okay. So they do a couple of injections, but the cats, unfortunately...
It's probably on its way out. By the time they start treating it was already around the bend, so to speak. Yeah,
starting early
is the key.
I started a week before my FIP results came back. So
okay, so you didn't dilly-dally at all. You just assumed that it is.
I didn't wait. No, there's nothing to lose by going for it. Where if you delay, then that's when we lose them.
Yeah. So talk me through your experience, the actual practicality of the treatment. So you get your little vial. And once a day injection?
Once a day, same time every day. Has to be sort of within half an hour or something every day.
And then the reports of it being a really painful injection, is it as bad as it?
It is. It's pretty horrible.
Yeah.
Some of it is obviously the cats are being restrained and they're not used to that. But yes, the GS is acidic, so it stings. And for my cat, I'm injecting 2.5 mils every day now. Quite a lot of fluid going in as well.
Yeah. So on a scale of other painful injections, I'm thinking ketamine. Is it like a ketamine reaction when you inject them?
Initially, it was like when you inject ketamine. It's the same reaction that you get. But then as you get into it, I think part of the reaction is the being held down. Some of it's over dramatics. So some days I'll inject her and I'll get no reaction at all.
Wow.
Which, whenever anybody has an injection where they don't react, we always just assume that we've shot through, and actually the medication is just on the cat or on the floor.
Yeah. So are you doing the cat burrito? Do you wrap her in a towel?
I've got a shower bag. So quite a few of us in the UK are using a mesh shower bag that you can get off Amazon.
Why do we not use these in practice? Oh, there we go. It looks like a superhero costume.
It's got drawstrings middle and back, and then you just need to cut little holes where you are doing your injections.
And then they freak out and that's it. It's how long does this thing last for? Is it like again like ketamine where it's like
literally probably 30 seconds, a minute,
and then they walk off grumpy and they're fine.
They walk off grumpy, and there is a thing that they get where they angry eat afterwards. So a lot of them will just go to their food bowl and stick their face in it and do this thing called angry eating, which is really good. A lot of them don't have great appetite, so angry eating gets lots of food into them.
Never heard of that. Is that a cat thing or is it a GS thing?
It's a well-known thing in my GS groups.
That's quite funny. Is it like when we stuff our faces with chocolate when we have a bad day at work?
yeah, shove it all in, or alcohol, in my case. down the glass of wine.
Okay, cool. And then, other than the painful injection, were there any other side effects? And on the chats, do people talk about things that go wrong that people should look out for?
They can get sores. I've been lucky, I've not had any sores, but they can get sores breaking out on the skin.
At the injection
I think
site?
different brands, there was a brand that was very bad for sores, which we don't use in the UK.
Okay.
That had horrific sores, but a lot of people just find scabs and raised areas and things.
At the injection site?
Not even necessarily at the injection site. Sometimes they just come up in different areas of the body.
Whoa. And so when you started your treatment, so you had ascites in your cat, was she off of food and unwell in other ways as well?
Yeah, she was eating little bits, but she wasn't eating as much as normal. So she was going in, having a few mouthfuls and then leaving it.
And then from starting treatment, how long until you started seeing changes, like positive effects of the drug?
She was on steroids before we started the treatment, so that did help with her appetite a little bit. But probably within a few days of starting the treatment, she had a ravenous appetite. So don't know what magic it was doing in there, but she was suddenly eating like 4 or 5 trays of food a day.
Wow. And the resolution of the ascites, has it resolved?
It completely resolved by day 14.
No way.
Totally gone. So she started off, first visit to the vet, she was 3.9 kilos. On day 14, she was 3.19 kilos. So she'd lost, 700 grams, which was all fluid loss.
Wow. So how long is the full course?
It's a minimum of 84 days. We have had our 8-week blood, so we are probably going to have to extend because our AG ratio is still only 0.4, so we want it higher before we stop treatment. Okay,
so you're using your albumin-globulin ratio as a treatment guide to say, that's the resolution there.
Yeah, there's various things. So the vets have looked at hers, and so I've now increased her dose to 12 mg per kg.
Okay.
And she's also on a thing called ProBoost, which helps the immune system.
Do you know what that is? Like what is in ProBoost?
Thymic protein, I believe.
And is that just... I wonder why they started that. Do you have any idea what it's supposed to do? Why specifically in these cases does it help? Any background info on it?
I did try and look it up on Google the other day. So there is a lot of information about it on their website, but I haven't actually read it.
Okay. No, I'm just curious. No, because this is the sort of stuff that is on the ground when we start using it. So if it was legal, how would it... Like if, let's say you could get this from your vet and your vet could be involved in treating this, how would it look different, do you think? Would it be something that most people would do at the vets? Like, would you go do your first injections at the clinic? Do you hospitalize the cat for a week or 2? Or would it still be a home injection thing? If you had to imagine this 5 years from now and it's readily available.
Yeah, I think it would be, the vets would start and then probably train the owners to do the injections at home. But it would be much easier for vets to do the injections with it being legal.
But the other question I had is, some people talk about giving their cats, because of the painful injection, slight sedative or trazodone or something.
Gabapentin. Gabapentin.
Did you try
absolutely.
That? Did you do
I've
that?
got, Mabel has. She started on about 50 mgs and now we're up at 100 mgs.
Of GABA
and it just makes her chilled. It doesn't make her sleep or anything, but she's just slightly less fighty for the injections. Gets over them really quickly.
Would you go Would you want a stronger sedative, or do you find the GABA's enough? Like
GABA's enough.
It's enough. Have you just got a tablet or a capsule? Because it's not like tableting a cat's that easy either.
So I put hers. I get a little bit of cheese, wrap around the outside of the tablet, stick it on a bit of butter, and she eats it.
And then how long after do you inject her?
2 hours, 2 to 2.5 hours. So I normally give it at 7:30, and I start thinking about doing the injection at 9:30, somewhere between 9:30 and 10.
And you think you wouldn't get to a point where you wouldn't use the GABA?
A lot of people do it without the gabapentin just because they have to.
Yeah.
But I prefer the fact that we've got a calm cat. It keeps me calm because the injections can be stressful. So knowing that she's got some nice pain relief on board and she's a little bit chilled, I would much prefer to keep going with the GABA.
It is stressful. I'd hate it if it was my cat. 20 years into vets, and if I have to inject ketamine into a cat, I'm still nervous about it.
I was having complete mental breakdowns every night. I was stressed for the whole afternoon thinking about it. Drinking so much alcohol every night after the injection.
To calm your nerves. Inject the cat, cigarette, glass of wine.
Yeah. But it gets better. Probably the first week or two are the hardest. Then you start seeing them responding, and you just have to think at that moment when you're doing the injection and the cat's fighting, you just have to think about what actually is happening, and the cat is just getting so much better.
You know those conversations that you have at conferences, back in the days when we still had big vet conferences, when people are chatting to the lecturers and asking questions, and you hear things like, "This isn't really in the books, but here's what I think." It's in those kinds of conversations that the best nuggets of wisdom appear, the nitty-gritty real-life details that you can only get from years and years of experience. And it's exactly those kinds of conversations that we try to emulate on the Vet Vault Clinical Podcasts. We don't want lectures. We want to hear about the challenges, the tips, the stuff-ups, this is how I do it. Go to vvn.supercast.net to join in the conversation.